Welcome to this installment of Beyond the Headlines. Now, this morning we delve into a crucial matter that often we sweep under the carpet: mental health. If I asked you out there, how healthy are you mentally? Would you be able to tell me? In other jurisdictions, they have ways of checking all of these. What are your balances in life, and how is it affecting your mental health? Well, just about last year, we heard from the health minister who was telling us, maybe alarming some of us, that about 10% of us, over 3 million of us, have mental health issues. Some severe, others not so severe. So what is the real picture? And especially as we've celebrated World Mental Health Day and we're celebrating World Mental Health Week, what are some of the advancements we have made in mental health care in Ghana? This morning, we delve into this all-important matter as we host two of our medical people from the Accra Psychiatric Hospital. When was the last time you passed by, though? So we have Dr. Victor Ogo,
yes,
who is with the Accra Psychiatric Hospital, together with Dr. Emefa Dzodzome. Accra Psychiatric Hospital. She was testing me on that second name. She felt I wouldn't make it, but thankfully I've landed safely. Thank you so much for joining the conversation.
Thank you.
Thank you very much.
So just to kickstart, the Accra Psychiatric Hospital has been around for a long time. How are you faring now? I ask this question, Doc, because in the past we've heard so many things, so many complaints, from a lack of logistics to so many things. Would you say you're in a good place right now?
Thank you very much. I'd like to thank all the viewers for participating in this program. I'd also like to thank our senior colleagues and our colleagues for making this happen. So, since I joined the Accra Psychiatric Hospital, there's been some improvement, okay?
And when you say since, I like to how long has this been? Just to put it into perspective.
I'm in my 3rd year there now.
Okay.
So
right.
There's been some improvement since from the days when I was in medical school.
Right.
But there's a lot of work that needs to be done.
Okay.
So we know that logistics-wise, there needs to be some improvement. Infrastructure-wise, there needs to be some improvement. Finances, manpower, and so on. All those things, we have a long way to go. Despite the fact that we've made some improvements since my medical school days, but still we have a long way to go.
A long way to go.
Yes.
That's an interesting perspective. For you, I mean, how long have you been with the Accra Psychiatric
Just under
Hospital?
a year.
Just under a year. Fresh blood, some would say. You're new in the system.
Yeah.
For someone as young as you, what has your experience been like at the Accra Psychiatric Hospital? What are some of the things that, I know you have the passion to work, that moving forward you would want to see?
All right. Thank you very much, Benjamin, and a very good morning to our viewers. Fresh blood, as you would say, but not so fresh, coming with new ideas, starting from a point where our predecessors left off. I would say that there has been improvement from the stories that we've heard, like you've mentioned. But it's also sad to know that there are many facilities, there are many services that are being underutilized in the Accra Psychiatric Hospital. Simply because underutilized.
You have them, but you're not using them the way you ought to.
Simply because of a lack of education. Accra Psychiatric Hospital seeks the total welfare of our patients. Right. When we talk about welfare, we are talking about treatment, we are talking about rehabilitation, we are talking about integration, which is often swept under the carpet. So we have the services of occupational therapy in Accra Psychiatric Hospital. We have clinical psychologists in Accra Psychiatric Hospital. And sometimes in the haste to get patients well, we forget, or families forget, sometimes healthcare workers forget that patients need to be rehabilitated back into society. We have a drug rehabilitation center. It is lengthy. We are taking people from a place of addiction, completely dependent on recreational substances, to full function in the society. So sometimes just because people are not aware of these services, people don't present for treatment.
Right.
Yes. And trying to bridge the inequality gap in mental health, it would be a literacy. Having people know that these facilities exist. You can walk into Accra Psychiatric Hospital without a referral. You can come to make inquiries. We are starting.
Oh, wow.
You can.
You're telling me you don't need any referral from any other institution saying that, oh, this thing you're going through, it's akin to maybe some mental health related. And when we speak mental health, and yes, you know, sometimes we ought to, we'll talk about the stigma, but you feel certain things that border on depression, for example. You can walk in.
Yes, Accra Psychiatric
Hospital.
Exactly. We both offer referral services because many times the point of entry into the service delivery is from other hospitals. But you can still walk in and ask to consult with a health professional.
Right.
And you'll be attended to.
Wow.
It is that simple.
It is that simple. So, you know, anything you may have thought in the past, just get your mind out of that. We're disabusing your minds. By the way, you can reach out to us on WhatsApp 0551 575757 with your thoughts, and if there are any questions you have as well, you can pose them via WhatsApp. So we're in Mental Health Week. What would you say is the current state of Ghana when it comes to mental health? I referenced what the health minister said sometime last year and all of that, but from you, the players right down there in the industry, what do you see? What is the state of Ghana when it comes to mental health?
Okay, so like you rightly said, like there's room for improvement. Okay, so like I said before, we need this lack of logistics, manpower, finances. All those things are kind of like impeding the service delivery that we know we can do more than we are doing now. Okay, yes, that's the main thing that is going on. But like having said all of this too, so I just want to chip in something so that I don't forget.
Right, go ahead.
Having said all of that, there are innovations that we are doing now. There are things that we are doing now to try and bridge the gap between those who have and those who don't have. You know, I mean, the theme for this mental health week is mental health in an unequal world. Okay, and we are
mental health in an unequal world.
Exactly.
Right.
So we know that there's that gap that exists between the have and the don't have, the rich and the poor, north and south, east and west. We know all that. So we are trying to bridge that gap. That's why for this mental health week, we are instituting a free call-in program. So you can call I'll share the numbers like later on. You can call and those numbers, there are doctors, nurses, psychologists, and other members of the PR team who will be available to answer your questions, take care of you. If there's the need for them to say that, okay, look, at this stage, you need to come into the hospital, we can do that. Okay.
So important point you're making there. I would have maybe had you make mention of it later, but it still fits aptly into the conversation. So we're trying to bridge the gap,
yes.
Especially as this is a very unequal world, and it's unequal on different phases. And when you come to Ghana, yes, there are the brackets of the rich, the poor, the haves, the have-nots, and all of that. All of those mean that some people may not even be inclined to seek assistance. So you're trying to bridge that gap. But this facility that you have, that you're starting, how long has it been though? Is it rolling already?
Yes, it started. It just started. Yes, it started. You mean the phone-in program? Yes, it started. Program. Yes, it's live. We are live on that. We can, as soon as you give the numbers, people can start calling in for that.
So in other words, all I have to do is, I feel I'm not in the right place mentally. I can call this number, or I call the number, speak to someone yes. specific. What kinds of people are we going to be interacting with? Psychologists,
psychiatrists, nurses, and members of the PR team.
Okay, so they are going to determine where we are on the mental health plane, so to speak.
Yes.
And right after that, if there is need to come to the facility proper, then that will be done.
Exactly right.
Emefa, now, you've been there for just over a year, like you said. How excited are you about this? I ask that from the standpoint of the fresh ideas you spoke of. Yes. I'm sure coming into the system, you came with many novel ideas, many things you wanted to see.
Yes.
Is this one of them? How do you feel about this?
I love the idea. I'm excited especially about telemedicine.
Telemedicine.
So the long-term plan of this call-in service is to establish a telemedicine center. We know that the vast majority of the youth is technologically inclined.
Right.
There are people in far-to-reach places. There are people who might not want to come directly to the hospital because they may feel a sort of stigma. But if there's the opportunity to simply, in the comfort of your room, in the comfort of your home, you can call in and have access to a professional, a trained professional.
Not to mention privacy.
The privacy, thank you, Benjamin.
Privacy.
The privacy. But let me chip in that our services are also very confidential, irrespective of whether it's on phone or it's walking.
Right.
I mean, we are medical professionals and we abide by a code of ethics that ensure confidentiality. So even in coming to the facility, you're ensured of your confidentiality. We also do offer home visits. So that's an option. That's always on the table. And
these home visits, do they come at a cost?
They do come at an extra cost. They do come at simply because of logistics.
Right.
Simply because of logistics.
So it's interesting. So you have this plan, and I'm excited about it because, like, we were interacting right before we came on the segment. In other parts of the world, people have very free access to some of these, and it tells in their performance at work and how they relate to society. Because let's face it, people with certain levels of mental health issues could do certain things that we don't want to see in society. We've seen different people do certain things, sometimes because they are not in the best of places. I mean, even at work, someone just does something and it's all because they're going through things that we've simply overlooked. But let me come back to you on the bit about funding for mental health. You've spoken about this new drive. How are you rolling it out? I mean, how is it being funded? Is it the states backing it up? Is it the mental health authority? I mean, how are you generating funds? I'm looking at the longevity of the project. How are you sustaining this?
Benjamin, you are right. In envisioning a long-term initiative, you need to think about sustainability. So this call-in service, for now, is restricted to the month of October. The telemedicine service I'm talking about is a long-term plan. Accra Psychiatric Hospital runs on state funding, basically.
Right.
But we need to institute new ideas. We have the ideas. We need funding. Do we wait till we get state funding? Not necessarily. We'd like to use this opportunity to, it's a call for sponsorship.
Right.
We need computers, we need headsets, we need resources to run this facility. We already have a lot of corporate, I wouldn't say, we already have some corporate sponsorship. And it would be our absolute delight to welcome all corporate bodies onto the system. But I mean, we are going to roll it out irrespective. We've set a goal for ourselves and we would definitely roll it out.
Right, so you've set a goal, and the telemedicine bit there,
Yes.
I don't know, are you rolling it out concurrently with this system, or is it going to start immediately after this month when the World Mental Health Month, so to speak, like we've stretched it, ends? What's the agenda?
So like I said, it's a long-term vision. It's a long-term initiative.
Right.
We want to start immediately. We get the baseline resources to begin. But for this month, we are focusing on the call-in center.
Right.
We are projecting, maybe in a few months to come, somewhere next year, I see funding rolling in after this program, Benjamin. So we would set up, at least so you can see who you're speaking to, not just on a call-in basis.
I like your optimism, how you talk about seeing funding rolling in. And let me just say this at this point. They do need a lot of help. I'm not going to take the wind out of your sail and say what you should, but we all know the sort of lack you face. And this came to mind. You remember at a point we had Operation Efiase, where the prisoners, you know, you could donate as little as 1 Ghana cedi to help the inmates and all of that. I feel if we all came together, imagine all of us, 30 plus million, what we could do to aid our own mental health. But that brings me to my next point, Dr. Ogo. The bit about children and mental health. Interestingly, right after Mental Health Day, because I think it fell on this Sunday.
Exactly.
So on Monday, we had a conversation on mental health, but focusing on children. And that's an interesting bit. They are a category that we often think, oh, we clothe them, we feed them, what could they possibly worry about? But they also have their worries. this on the back of COVID-19, which has impacted them, on the back of not going to school and so many things, on the back of child labor. What are the provisions in this new policy, this direction? How are you targeting children as well? Is there a focus on them? And can a parent, for example, say, okay, I'm calling the number, my child is going through XYZ, you would speak to the child, and I mean, what is it like?
Okay, thank you very much. So, of course, children are included in everything that we do. In the OPD, everything we include children. They are not like neglected in any way. However, like as you rightly said, a lot of people don't think children have mental health issues. They do. And sometimes they don't express them in ways that we think that they should. Like, children are not little adults. You know, they are whole human beings on themselves. So they express their mental health issues in slightly different ways.
Right.
Okay. And as you rightly said, for the COVID period where we weren't allowed to go out, school was out, and so on, all those things can impact the mental health, like well-being of the child. The child is not interacting with his or her fellow peers. The child is not going out to play. The child is not going to school. The child is worried about what is going on. Mommy, why aren't we doing this? Daddy, why aren't we doing that? All those things can cause them to be asking questions and increasing their anxiety levels. And also, I forgot the point I was going to make anyway. Yes, exactly, and increase their anxiety levels. And another part too that we'll forget is that during the COVID period, actually it's still ongoing. So people are losing their lives, people are getting sick, people are in long-term care, and the child can't really process that kind of information like really very well. So then they will exhibit it in different ways, through anxiety, through depression, and so on.
Right.
And if there's any underlying condition that the child may have had previously, this is the right time for that condition to come out, you know, because of the ongoing stress, anxiety, and the COVID thing that is going on. This is the right time that it should like it to come out. So like you said, yes, we include children in everything that we do. For the phone-in program, if a child needs help, please call in. For even the most mundane thing, you call, get professional help. We will determine whether it's quote-unquote normal or not, and then we can move in from there.
Yes, but even as we talk about those, and I remember interacting with Dr. Asafo the other day, what are some of the things, especially for someone who is watching and thinking, so what should I be looking out for when it comes to my child, and how they could be expressing mental health issues without my knowledge? You know, sometimes we all take it for granted, or it's just children being children. What should parents out there especially, be looking out for?
All right. Thank you, Benjamin. I think that sometimes we assume, like what Dr. Ogo rightly said, that children may not present in a typical manner. But we assume that these things may be obvious, very flashy. For instance, if a child is in school, teacher complains that for no apparent reason, child's grades seem to be slipping. Child seems to be withdrawing from their friends. Child seems to be losing interest in the things that they would usually like. So you want a child to go, say, for a co-curricular activity. Child says, no, I want to stay in my room. Typically, something that often...
So you realize there is that dislocation.
There is an isolation.
They don't want
yes,
to
it's a withdrawal.
Interact with others.
Exactly.
It's a trigger.
It is. And in children, sometimes they present with physical symptoms. So you see this child constantly complaining of, my head is aching, my tummy is aching, you keep going to the hospital, you're unable to get to the root of this. These may all be presentations of a mental health illness in children. These are just a few. I could go on and on and on and on. Yes.
But these are some things to look out for.
These are some things to look out for.
The child gets,
yes, please. The child gets angry a bit more easily than usual. Child is no more
temper issues.
Temper issues. Sometimes we assume that children are not entitled to emotions because we are providing for them. We need to teach children to identify and correctly express their emotions. So when you see children, we call them temper tantrums, you see children reacting out of proportion to the incidents that occur, you need to start worrying, what is going on with my child? Is there something that I don't know? What psychological challenge is my child facing? Also to chip in that the provision for children is not an entirely new one. We have a child mental health clinic ongoing. On Wednesdays, you can come to Accra Psychiatric Hospital. We have child psychiatrists who are identified, specialized, narrow down their approach to take care of your child. So please do come. Do come. Help is readily available.
Let's talk about, even as we talk about accessing mental health care, we know that there are certain bottlenecks, impediments that sometimes don't make people even want to access it. We've spoken about some of them, but one important one that we started talking about, which I said we would shift for later, is stigma, stigmatization. And like I started painting the picture earlier, let's assume I see that, no. Look, some of us, the times we have to wake up, sometimes you're sleeping terribly late. You have to wake up very early, running around town, get here, you have to be on top of your stuff. Yeah, all of that and the different pressures of different people's work can put you in a place sometimes that you don't want to be in, especially if you're not taking proper care of yourself. And immediately you think, I want to seek assistance, medical assistance. It starts ringing in your head. Hey. Just to play because society has fed us with a certain thinking that once there's something going on upstairs or with your psyche, it means you are losing it. That prevents people from even coming to you. Okay. At least that is what we know. Is that the reality, Dr. Victor Ogo? And how is this facility that you're now bringing to bear going to help bridge that gap?
Yes, the short answer first is yes. It does affect access to mental health care. So, like if somebody has an issue and he's thinking, okay, what will my friends think if I'm going to seek help? Like, I have a psychosocial illness. All those things, like as you rightly said, will impact on the person's access to the healthcare. But there's also another issue, like I'd like to bring up now. So for Accra Psychiatric Hospital specifically, and other mental hospitals generally, our infrastructure is not so great. Okay. So Accra Psychiatric Hospital was built originally as an asylum. So it was designed to keep people in. Okay. So imagine if now I need to come there, I'll be a bit hesitant on approaching that place just because of the
imagine
history,
you were not in this line of work and Emefa knows you, and then someday Emefa is driving by and sees you going in and hey, dog.
It's a possibility.
Right.
Okay.
Right.
But what we are doing now is part of the healing process. It's part of the destigmatization process. So the more we talk about issues, the more people become aware of what is going on. Then they start thinking that, it's not so bad to seek help. Right. If I have depression or anxiety, even though it's a psychosocial issue, it's also a medical condition. Right. I don't feel stigmatized when I'm going to see my GP for hypertension or diabetes or whatever. I don't need to feel stigmatized when I'm going to see the psychiatrist or the psychologist, and so on. I know in other jurisdictions, stigma still exists, okay, but it has improved. Okay, and
the levels here are much higher.
Yes, they are much higher. I can't quote figures, but I know that anecdotal evidence, they are much higher.
Right.
Okay, and how did they reach that level of quote unquote success? Okay, by what we are doing. They talked about it by normalizing psychosocial conditions. Like in other jurisdictions in US, UK, you find people, they will tell you, oh, today I'm going to see my psychologist, today I'm going to see my psychiatrist. I have bipolar disorder, oh, I have schizophrenia. And they'll tell
they say it very
they say it like
easily. I'm going to see my shrink.
Exactly.
They have that,
that's a good point. Exactly. Okay. But it's because workplace, society in general have a more positive outlook towards it. Okay. Right. So if they say today, if I say, they say I have schizophrenia, for example, as long as a person is functioning at work, being productive, doing what they have to do, okay, they are not going to say that, okay, you can't hold this position because you have this, this condition. Same thing with bipolar and, other conditions. So the point I'm trying to make is that the more we talk about it, the more it becomes normalized and the greater the destigmatization that is going to occur. And workplace is very important. Sorry, right. It's because the workplace should be accommodating. Okay, so if you're at work, you are stressed, you know that, look, you are reaching your limit. You can ask your supervisor, your boss, hey, look, I'm going through this, can I get, a couple of days off, one day off to go and talk to somebody? All those things, help. Of course, we in the profession, we don't stigmatize anybody. We welcome everybody. You can come anytime. We're open 24/7. We set up this new phone line system. So hopefully, in the not too distant future, we should start seeing like good results.
Very important points you make there, and that's particularly why we're having this conversation here on Joy Prime on Prime Morning, to create that education, if you like, awareness of the situation. And that bit you mentioned about workplaces, I feel that's another area we ought to be targeting, because at least not in my experience here, but in other places, people would tell you, I've been working for this long, I don't even get to go on leave. Even when I'm on leave, they will not allow me to, get my rest and all of that. I guess all of those create problems. And I think it also boils down to sometimes people at the helm of affairs not thinking you even require. Sometimes you are in desperate need of mental, assistance. And someone thinks, oh, you're just being dramatic, when in reality you need assistance. So that's a very important point you make there. But I want you to do this. When we talk about the stigmatization, people think, oh, well, I don't want to go so that. But what is the reverse? Not going, what are the consequences? Let's say you are schizophrenic, or you are suffering some anxiety disorder, or maybe you've even lost a loved one. That's another one we take for granted. You've lost a loved one, you are going through the phases. And someone is even telling you why are you sundodo? You don't even, you know, that kind of thing. People like that, if you don't get the right assistance, there could be consequences. I think we should paint that picture so that people know if you don't seek assistance, this is where you could end up.
Okay. Thank you, Benjamin. I'd like to chip in that a lot of times in our minds, we categorize people into those who have mental illnesses and those who don't.
Yes, we all.
However, it's a spectrum. It's a spectrum, Benjamin. It goes from excellence, you are excelling, you are thriving, then you're just surviving, you're struggling, and now you're in crisis. And all of us could be in either stage at different points in our lifetime. So the fact that
it's fluid.
It's fluid. I could be here today, something could happen like you rightly said, and then I would progress, or I'm going down the ladder, I'm entering into crisis. So being in crisis in a particular point in time in your life does not necessarily mean that you're forever tagged with the label of, for instance, if you are going through a grief process, that is becoming depressive. You're getting an affective disorder now. It doesn't mean that for your entire life, you're going to be tagged.
It's just a phase.
It's just a phase. It's just a phase. But oftentimes we see that people are presenting at the latter ends of the illness. So now you see people being brought in chains. People have been sent to prayer camps. people have been starved, because the illness has been allowed to progress. What we see outward, we see people walking around, that's our idea of mental illness. We see people walking around, causing havoc, maybe assaulting people. That's an extreme that we don't need to get to. If we keep seeing people in this extreme, then that's the idea we have of mental illness, when it's not actually so. Like Dr. Ogo rightly said, you're in your, like you both mentioned, you're in your workplace, you're starting to struggle. If you don't seek help, you're going to enter into crisis. That may result in, for instance, a full-blown episode at work. And that increases, that worsens the cycle of stigmatization.
Give us a picture of this episode. Like I said, you would see people burst out, do things that, but this person is such a calm person, all of a sudden, boom, the person is...
Okay.
Is that what you're talking about?
So that is what I'm talking about, but I'm hesitant to paint that picture because that's the stereotype, that people with mental illnesses are violent, people with mental illnesses are abusive. Meanwhile, the rates may not actually be too different from the incidences of, for example, physical aggression in the general public. So that can happen. But also, like we mentioned, we see people losing functionality. So you see someone who was previously very active at work, someone who was productive, suddenly the person is not producing as much, the person is not going to church, the person is not engaging in social activities.
Question marks. We have to be asking why.
We have to be asking why. So it's not, you don't always need to be looking out for the outburst. Sometimes you need to be looking out for the withdrawal as well. These are all evidences of progression, severity of disease.
Wow. I love the discussion we're having because it's opening my mind to so many of the things that we really need to be looking out for. And so if you don't take this seriously, you know you're going through stuff, you're not in the right place, mentally speaking, things are going on in your life. Like I usually say, you don't have that balance and you take it for granted. Well, the imbalance could get to the point where, Charlie, instead of this, you are ending up with something you don't want. But you mentioned, so the assistance, this new initiative, I intentionally had you wait for a while. I would now have you put out the number.
The number is okay.
And so basically it is that if you're going through anything, whether post-COVID, in all these things, maybe it could be work-related, it could be other social matters, and you feel you need assistance, Doc is going to put the number out there. The Accra Psychiatric Hospital is offering free assistance in the month of October. You can call that number. They will give you an assessment via the phone, and if you need to come to the hospital, you can follow through on that, Doc.
Okay, yeah, so, okay, so like I said, we have more than a couple of numbers to give out. So the first one is 057.
And I'll just have you slow down a bit when you're mentioning them so people can actually. Okay,
so the first one is 057 223 2619.
Can you repeat that?
057 223 2619 and 057 769 0753. Repeat again. 057 769 0753.
Okay.
And 050 185 9321. Again, 050 185 9321. Just 4 more to go. 050 927 1541. 050 927 1541. Okay, the next one, 059 940 2207.
Okay,
again,
next one. Okay.
059 940 2207. Next one, 059 937 9011. Repeat, 059 937 9011. The last one, 059 937 8377. Again, 059 937 8377. And we can call anytime between 8 a.m. and 5 p.m. daily.
8 a.m. and 5 p.m. daily. I captured 5 of those numbers.
Okay.
But quick question, just to make it more simple, why don't you have maybe just one hotline that people can connect to, simple number, and then from there, there's an extension that guides them to different people they can speak to. I'm just thinking, why not have, let's say, a 0 this, and that's the main hotline. When you connect to that, then you can get the others. I mean, what do you think about that?
I think it's a good idea. I don't know the logistics that went in to get like these numbers, but I'm guessing, this is just a guess, I'm guessing it's a sponsorship thing. You know, so like if we can get like corporate bodies, corporate institutions, even private people to sponsor the phone-in program, perhaps we can go like into your direction.
Right.
So I have just 2 numbers that I'd like to share for corporate institutions, even private individuals to call if they want to assist in this phone-in program. So it's like a call to sponsor, you know, this phone-in program. So just 2 numbers, yes. So 057-223-2619. I'm repeating again, 057-223-2619. And the second one is 024-472-7856. I'm repeating again, 024-472-7856. Thank you very much.
So those are for corporate bodies. For individuals who want to assist, like you said, the different equipment you need and all of that. How can they go about that?
We can go through similar channels. There's PR, and we're welcome to it. We are welcome to it. We are looking forward to it. We can't wait to have
So the individuals as well can go through the same channels.
They
can call those very numbers. That is the last 2 you gave.
Yeah, the last 2 numbers, yes.
Right. Well, we're very grateful that you've joined us this morning. Lots that I have learned that I believe others out there watching us have also learned. What would be your parting remarks, and what should we expect, actually, from you in the course of this mental health week and month? I'll start with you, Emefa.
If I could leave anything with our viewers, it would be that seeking help for mental health conditions is not a sign of weakness. It's a sign of strength. It takes strength for you to recognize that I'm going through a challenge. If I'm left alone, I could enter into crisis. I need help. And there's help available. So it will be sad to see people going into crisis when there's help available. So please seek help. Please seek help, because there's help readily available. Also, talking about the future, a lot of times we assume that healthcare services in Ghana, maybe because they don't match standards elsewhere, they are not enough. But I mentioned that we have occupational therapists, we have drug rehabilitation services, we have clinical psychologists who are there to support you, to help you live a holistic life. Like you rightly mentioned, mental health involves identifying your abilities, being able to be productive, coping with the natural stresses of life, which we all face. So there's help readily available. We're there for you.
I like that. Mental health, we day for you, or them day for you. Your parting words.
Yes, okay, thank you. So if this was an exam, like I'll say that Emefa stole 2 of my answers, but it's not an exam. So, but I'd like to say that more seriously, I'd like to say that like together with what she said, if you need help, seek help, anything, talk to somebody else will talk to somebody, and so on. For children, parents, teachers, and other adult caregivers, very important. If they notice anything, just seek help. Then I would like to talk a bit more on stigmatization. So like we've been saying for the past few minutes, mental health issues, psychosocial issues, it's a medical condition. You don't need to stigmatize anybody about it. Like she said, like my colleague said, it can affect anyone at any time, at any place. We don't know when and where it's going to happen. So if somebody is and behaving in a way that you think is not appropriate, rather than hiding in a corner somewhere and laughing and pointing fingers, you can actually assist the person, help the person, call somebody, and then we can take it from there. So please, let's help reduce the stigma together.
Together we can. My parting words would be that, like I always say, it's like me. I'm using glasses because my eye situation has progressed to this level. Practically all of us have eye issues. It just may not progress to the point where you're using glasses. Same thing. We all have mental health issues in different ways. It may not progress. So look at your balance and seek help when you need it. Dr. Victor Ogo is with the Accra Psychiatric Hospital. Thank you so much for joining us. Dr. Emefa Dzodzome
yes,
also is with the Accra Psychiatric Hospital. Thank you so much for joining us.
Thank you for
we day your back. You day for them, we day your back. Right. And that is how we wrap our conversation on World Mental Health Week, like we're celebrating it, and month. Take advantage of those numbers they've given and that service. But coming up next, we talk relationships and parents and their involvement, positive, negative, the impact, the way forward. We get into that conversation right here on Prime Morning Tuesday.